We'll go ahead with the next presentation by Dr. Meena CK Madam. She's a she's the senior consultant, Little Flower Angamali. We'll be having an interactive case-based discussion. Over to you, madam.
Good afternoon, everyone. And this is I'll be going through a few case scenarios, and if time permits, we can have discussions. Otherwise, it could be boring also. So, what is happening now? Like, all the parents were quite peaceful with giving a screen or a tab to a child, and they could rest in peace. But now it has become, everything has become ulta, and now what we advise is something like a Gurukula Vidyabhyasam, where they have to go into the sunlight, you have to be outdoor for 2 hours. So it has the life has become very difficult for parents actually after all this. So these are the main things that we have to prevent myopia progression, like lifestyle and environmental changes. And as mentioned earlier, you have the pharmaceutical agents and the optical measures with which we can prevent progression. So I'll be talking about a few cases, and if time permits, we can discuss about it. So I've just divided my cases into pre-COVID, COVID, and post-COVID, and I was never aggressive with all these myopia progression measures, and I was always little hesitant to start all the drops, the glasses, etc. in the beginning. But now, obviously, we know that after the COVID, the things have changed a lot. So this was a 9-year-old girl who came to us in 2017, and she had a history of using glasses for 4 years, and it was from a nearby optical shop, and her mother was a myopic. And you can see most of the children who come to us, they will be undercorrected. Here you can see the child was using 0.25 and minus 1.5 sphere, and we did a cycloplegic refraction, and glasses of the correct power was given. So immediately I did not start on any measures, just gave the glasses, and this was in 2017. So then the child came once, and it was okay. And in 2019, there was a progression to -2 and -3.25. Started on low dose atropine. During this was a second or third visit, we started the low dose atropine. Then obviously the COVID started, and most of the patients, when they come even after 6 years, they will say it was COVID, so we couldn't come. That is the usual we hear from the parents. So this was from 2020 to 2023. There was no follow-up, and obviously they would have stopped the medications, and there was only a 2 diopter jump in 6 years. Like here you can see it is -3 and -4, and we started her again on the drops. She was on irregular medication, and we restarted on the low dose atropine. So this is a girl from 7 to 13 years we have been seeing. It was only a 2 diopter increase and on irregular medication. So I was always apprehensive, like whether you have to give drops for all the children. There is a natural progression of myopia which was happening earlier. So this was not a very high rise, but still, since we have all these drops and glasses now, we are giving, and after the COVID, the things have changed. So what is your opinion, Dr. Sandra, in this case? Now the child is 13 years. We'll continue with the drops. It's been so many years now.
So this is a common scenario we encounter,
Yes.
because many children during that COVID period, they have lost to follow-up. And now that the complaints to the drops is also not sure during that period, and we have seen a 2 diopter increase. So irregular medication, either currently, do you have the action length documentation?
No, we didn't have that time, the action length
so
documentation.
once if there is a possibility, we can judge that, because more than the power, the action length will give earlier indication. But since that is not there, either combined approach can be tried.
Okay. Many of them, they won't opt for the glasses. When they go to the optical shop and see the price, they won't opt for the glasses. That is one problem.
Otherwise, you go for a higher percentage, provided
now
you
we can go for a higher percentage.
Yes, right now. And you give some like a card or something for judging their compliance. You can give some other pointers, some regular reminders, or closer follow-ups to the patient.
So So coming to the next case, this is a 7-year-old boy using glasses since 9 months. So actually the grandparents had brought the child, and it was in May 2018. Obviously the child was undercorrected. It was -1 power in the glasses, and then we did cycloplegic refraction, gave glasses, and as the child was planning to go to UK to join parents, I started the child on low dose atropine. Anyway, there was a -1 difference in both the eyes. Started on atropine. But the child didn't use actually. He couldn't go immediately, and though I prescribed, the grandparents didn't buy, and they came after 3 months, and in 3 months there was a progression. So they said, okay, we'll use the drops now, and on drops there was a mild progression. I saw the child again in 9/2019, and you can see the difference. It was -2 and it has become -3 and -4. Maybe they were not using the drops properly. And 2020 the grandparents came for prescription. The child was in UK. So we didn't see the child after that. And in 2022 you can see the progression. It has become -8. That is after that COVID time. So they came in 7/2022. This is in 2023. And they were using myocare glasses by that time. They already came with myocare glasses. And we asked them to continue the drops also. And now it is, maybe it won't grow more. It is like -8 in both eyes. So we saw the patient again in last of 24. And in 1 year it was stable with myocare. We had asked them to continue the drops, but they discontinued. But now the child is almost stable, but the power has increased so much, like -8. And Monisha, you have anything to talk on that? Anything because we couldn't do anything different, child was not there.
Probably we can start on combined therapy, ma'am.
It's on combined now.
And or increase the dose of the atropine.
Yeah.
Yeah.
So in next visit, if there is any progress, maybe we can increase the dose of atropine.
But that much of a high jump in the myopia,
yeah, 6 diopters.
6 diopters, we should really look into the axial length and the lens thickness.
Axial length is there actually. I didn't, but the initial one I didn't have, so there was no point in putting it. So maybe now we will follow them. Yes. And the next one is a 7-year-old girl seen in July 2018, and that was the first visit, and we gave glasses. And reviewed in 3 months, and she was fine. And close to 1 year, approximately 1 diopter change. And I started on topical medications. Until May 2020, she was stable. And in December, she had a sudden progression. Like started with 0.75 and 1, and went to -3 and -4. And she has been using drops. They say they have been using drops continuously, but there is a progression. So we made the dosage BD. And again there was a jump in mid 2023 on to 2024. You can see it's quite high, -5.5. It has become, this is the last follow-up, and now it is more or less stable with BD dosage. Since 1 year she has been on BD dosage, but there was significant progression. So continuing with BD dosage, maybe we can increase the concentration now. Gigi.
Now it's almost under control, no? The second.
It is now 1 year control now.
Yes, so continue the same, and we close follow up, and if
that is what we are planning to. So she is now 14 years. We'll continue with the drops. That is what is we are. That's all. So this is all started before COVID. Now coming to the COVID things, we have follow up less, but we know what to do now. So this 11-year-old male came in December 2020. There was no history of spectacle wear, and main complaint was in the left eye. So he had just a simple myopic astigmatism in the right and a combined one in the left. And we prescribed glasses, and there was progression in 9 months. That was a peak COVID time. Then we started on drops. And here you can see he developed a myopia, simple myopia in the right eye also now. And the left eye from 2.5, it has gone to -5. Maybe availability of drug was not there that time. And he was stable for about 3 years with continuing medication. And you can see the sudden progression. Like started with -2.5, went to 5, and Now it is progressing, mainly in the left eye it is progressing. And the right eye it is almost stable with minus 1.25. And here we have the axial length, like if we have an axial 21 we had taken and 25, and it was 0.4 in the right eye and 0.8 in the left eye. And we added peripheral defocus glasses also. And this is the summary, like 11 to 16 years, right eye is maintaining 1 to 1.25, and axial length is 0.4 and 0.8, and medication continuing. So I was thinking, like, can we do all these treatments unilateral? Even glasses, what is your opinion, Dr. Sandra? Like all these defocus glasses?
Yeah, right now the child is 16 years old.
16 years.
Right now the axial length shows, what is the change in the axial length in the last 1 year?
1 year we don't have actually. From 21 to 24
Yeah,
and
so
we have.
the thing is, it won't progress in the same pattern. So
that's it.
when you have the axial length stability, I think it's premature. You can just see within 3 months what is the axial length. If right eye shows exactly the same axial length, then you can stop one of the interventions. If they don't, a better thing will be to stop the glass, because then they don't have to buy the costly glass again. So you can.
And do you think that always this axial length will correlate with the diopters?
No.
It
will
doesn't
not correlate.
It doesn't
Especially
correlate.
in the higher myopia.
So it's not always you can depend on
you will
that.
have some idea. Like you are having two things, both spherical equivalent, and you are having the axial length. But it will not exactly correlate.
Okay. So now we'll go to post-COVID. It becomes shorter then. This 10-year-old female, seeing they have been seeing elsewhere. Again, you can see the correction they are using is less. So it's almost double now, the power. And she has been using glasses for 4 years. So immediately we started on dual therapy, both drops as well as glasses. Father is a high myope, so we didn't want to take any chances, immediately gave. And this 6-year-old, again in 2023, right eye is amblyopic, like you can see the vision is only 612, improving to 612. Started with 636 to 624, became 612 in 24. And she was not regular with amblyopia therapy, and we counseled well, and then they started adhering to amblyopia therapy. And 1.5 years, no significant progression, but you can see in 6 months, vision improved along with myopia progression. So the diopters has also increased and her vision is also increased. So now she is on glasses. I'll stop now. Time is up. Okay. Thank you for your question.